Right, good evening, everyone. Welcome to this pre-recorded webinar on switching from NHS services to private practice. Today, backed by popular demand, we're joined by Patient Plan Direct. Today, we're joined by Dan Nolte. Hello, Dan.
Hi, Chris. Thanks for and everybody else. Thanks for having me along. Really appreciate it.
No problem at all. Thanks for joining us. And back, despite popular demand, I'm Chris O'Shea. I'm the managing director at Samara, and I'll be taking over webinars from now on. So let's get started. So, Dan, this is a really popular webinar. We've got a lot of people signed up for this one. So it's something people want to know about. So why don't you tell us a little bit about Patient Plan Direct, what makes you different from other providers, that kind of thing.
Okay, brilliant. Well, I'm not surprised. It's a popular subject. It's the topic of choice in every practice we pretty much speak to. So a great topic to run through. So quick introduction to Patient Plan Direct. We're of the four major plan providers, we're certainly the most cost effective. We've been around for 15 years. The reason why we're the most cost effective is that we solely concentrate on your plans and your plan offering. We don't offer the extras like a little bit of compliance help and things like that, because we're fully aware that the practices don't use those basic things anyway. They pay for their own over and above. So because we're solely focused on you and your plan provision, that's all we charge for essentially. So that's why we're the most cost effective of the major plan providers. We're a practice or a group branded solution, so everything goes out with your logo. We don't have any interactions with your patients unless you specifically ask us to put a communication together for you. But again, that communication would go out with your branding on. We provide expert support and training with regards to your plans and your plan provision. So we're there for advice if you want help on pricing, and even as far as your pay-as-you-go fees. Your private treatments, if you want advice on that, so we can set the plan prices accordingly and make sure that it's profitable for you. We give you more support on that, and training your team as well on your plan provision and how to talk to patients and follow up and advice and that sort of thing. We've got marketing tools, leaflets, again, all practice branded. We'll do those for you, and posters. And we offer complete flexibility. We don't dictate to you what type of plan you want to offer. It's down to you what you tell us you think your patients want, and then working out the best plan for you and your practice. One of the big things for us is we're really desperate to be a paperless organisation in this climate of sustainability. Our online portal was built with a view to patients being able to sign up online at home really easily, or in practice on their own mobiles if you're emailing them a QR code or a link, and for the reception team to sign patients up really quickly in front of them. And we've got a first-class global accident and emergency scheme, which gives access to your plan patients. Reimbursing funds if they've had a dental emergency while abroad or anywhere in the UK, and accidents, cancer cover, hospital night stay. It really is a first-class cover, and it's all included within the price. It's not an extra. I think the other big thing as well is we're not a corporate organisation. We're an independently owned business, which means that we can be a bit more quick-footed around making changes and reacting to what's going on in the market. We're growing massively, and it's all pretty much by word of mouth, which is sustainable and the best way to grow, really. So we fully believe we're everything you need for plan success, really. So why pay more? Come to us.
Nice, a great slogan. As a marketing manager, I can tell you the word of mouth. If that's working for you, then that's a really good sign. So that's brilliant.
Thank you.
So switching, why are so many dentists switching from NHS or considering leaving? What's happened?
Well, the big thing really is alleviating pressure. The stress and exhaustion within the industry is at an all-time high. Mental health is in any industry, mental health is beginning to become more of the forefront now, but in dentistry particularly, there is a lot of stress and exhaustion out there, and that comes on the back of a few things. I mean, one of the big things with NHS practices at the moment is recruitment and retention of staff to work in NHS practices and conditions. That treadmill, of getting patients in and out of the chair as quickly as possible to hit unrealistic targets, it's just not enjoyable, and it's not why many dentists actually got into dentistry in the first place. Because all you're doing is day after day is putting sticky plasters and fixing problems, rather than actually being able to spend a little bit of extra time and teaching patients more and more about prevention and improving their all-round oral health. So that's the big thing, really. But also the associates now, they're more attracted to private dentistry, Instagram and cosmetic work. And so actually getting dentists in, especially following Brexit, to work in the NHS and under the UDA system, it's really, really tough. So because of that, there's people are finding they've got huge clawbacks on their UDAs, which is obviously a huge financial issue and pressure. And talking about finances, one of my practices in Leeds told me a couple of weeks ago that they sat down and worked it out with their accountant, and every time they did a root canal on the NHS, they were essentially burning a £20 note. Because once their costs had been taken into account, it just wasn't making the practice anything. So she's looking at handing her contract back on the back of that, and she was quite shocked by it. But it's the same for practices up and down the country and the whole of the United Kingdom. It's not as financially rewarding as it once was, and often practices will also find that their private income essentially will be subsidising the losses they're making on the NHS.
You're essentially working for a quota as opposed to for the patient.
Completely. And the other side of it as well is because more and more practices are going private or increasing their private number of patients and access to private dentistry, and couple that with all the articles that have been on BBC News the last 6 months about the lack of NHS places, the waiting lists. I believe Cornwall's got a 5-year waiting list on average for the NHS. There's a lot of consumer acceptance of their access is going to be on a private basis. There's never been a better time really to do it than now.
Private dentistry is pretty much the future. Whether for good or bad, that's essentially where it's going to be going.
Definitely. And we've got the other thing you've got to think about as well and look forward at is the political situation. So next year there's going to be a general election. Are the Conservatives going to make any changes to NHS dentistry before then? I very much doubt it. Are they going to get in next time? If they get in next time, then perhaps there probably will be some changes to NHS dentistry. But if Labour get in, there's no way in the world they're going to get rid of NHS dentistry. So is anything going to happen? Because it's looking more and more likely a Labour victory. Obviously, we don't know, crystal ball, but that's something we've got to think about and think ahead to. Are we prepared to carry on with this status quo for the next 6 years?
So, I mean, that kind of brings me on to my next question. What about a partial switch? Because if we're not sure what's going to happen, you might want to just hedge your bets, or you might not be able to afford it. But so, what's the difference between a partial and a full conversion?
Great question. So, where a principal isn't sure how it's going to go down in their area, what the reaction is going to be, it might be an idea to just sort of dip the toe in the water a bit. What I would advise is don't do it tentatively. Really give it a go. But what it means is that the principal, essentially, or principals will stop seeing NHS patients, will write to the patients they've seen over the last 2 years and say, we're not offering NHS places with Mr. Smith or Mrs. Singh anymore. And you've got two options. You can either go and see another associate of the practice on the NHS, but if you want to carry on seeing the principal dentist, you've got to sign up on a private basis, and that's, please see our website for the fees. Or, by the way, we've introduced a really new exciting plan that's more cost effective. So that way it makes a first step towards. Now, in most cases, once the principal's gone, within 2 years, the whole practice is gone, because the other associates start knocking on the door and seeing that, they're not suffering from the same stress that they were before. And actually, do you know what? I want an extra 5 minutes in an appointment, and don't want to be rushing people in and out of the chair. So it's a good initial step if you are really nervous. But obviously, what you've got to bear in mind is will the LAT reduce your contract on the back, or are you going to have to try and find room to hit those extra UDAs amongst your existing team? Is your team set up for that? Have you got enough staff? And if you haven't, financially, can you afford to be putting that money aside ready for the clawback for when you do hand your contract back? So there's lots of things that we need to consider, but we'll chat that all through with you and make sure you're fully aware of the pitfalls and the decisions you've got to make.
Okay, so with what we just mentioned in mind about not really knowing what's going to happen in the future, do you think this is a good time to do it?
Yeah, there's never been a better time to do it, and the reason being is some of the reasons I've said before is that your patients are half expecting it. They're not going to be able to. They're largely not going to be able to go and see another NHS dentist. We have had situations where the NHS put the contract out to tender and a practice will open in the area. That's happened a couple of times, and we do see it affect plan patient numbers, but it's been nowhere near as much as we predicted it would be, or were worried it would be, and that's primarily because patients have been looked after so well by their dentists in a short period in the last few years. Why would they go elsewhere just because it's the NHS, especially if they've got an affordable route into private dentistry, which is on a plan. So yeah, it's never been a better time, because they're just not going to be able to go anywhere else unless a new practice opens. Yeah,
that's a really good point. So you mentioned plans. So why is a payment plan so key to switching from NHS to private?
Good question. So the perception is amongst patients and the general public is that private dentistry is expensive.
Yeah.
So if you can give them a route into private dentistry and break down the cost monthly, for argument's sake, it's £60 for an exam, £75 for a hygiene, and if someone's coming every 6 months, like most people should be, then that's £135 every time they come. £270 a year. If you break that down into a plan and offer a slightly reduced basis, we usually recommend about a 10% reduction in the cost of the pay-as-you-go. So before you launch the plan, we look at your private fees and see where we need to price them to make sure that the plan is still affordable for you. So you'd probably be looking at that basis, £270 a year, maybe a £20 a month plan for 2 exams and 2 hygiene visit. Now, that's far more attractive to a patient to pay £20 every month than forking out, 135 quid every 6 months, and particularly where people have got a budget with regard to the financial climate as it is now and the cost of living, etc. So it's a really important inroad for the patient and an introduction to them into private dentistry, and it kind of softens the blow a little bit.
Yeah, that makes complete sense. I mean, I know that if I was getting sprung on that, I'd fancy a plan as well. Yeah, that makes a lot of sense. So let's get to the nitty gritty. What are the actual steps the practices have to take, and what support will you provide during those steps?
Yeah, so I mean, we've got step 1 here as a viability analysis, but even before that happens, we will probably be having 2 or 3 conversations, and we'll come and sit down with you, try and get to the nub of what the issues are and what you need to do to improve your situation going forward. And once we've once we've decided, you know what, let's look at this properly, we then look at the numbers. So we'll look at your adult patients, your number of exempts that you've seen over the last 2 years, number of kids that you've seen in the last 2 years. And then we come up with a number essentially where we think you need to get on plan, number of patients on plan that you need, so that generates a percentage of your UDA contract equivalent. And then on the back of that number, history tells us that number of patients usually generates enough treatment and cosmetic work to cover the remainder of the NHS contract. So that's sort of step one, and that leads us into sort of an in-depth financial analysis. Now, this is not a full accountant, looking at all your costs, etc. But what it is looking at your private fees, your treatment fees. Where do we need to price those to ensure that you're earning that income that you need to replace your NHS income? So step 3 is then we talk to the principals about the team buy-in, engagement, and how to talk to your team, get them involved as early on in the process as you can. We've got to identify early any issues within the team. Is somebody not on board? You do tend to find that a nurse or receptionist who's staunch NHS and been at the practice a long time, they can sometimes be a bit of a blocker. So we need to pick that up as early as we can in the process. So it's really about making sure the principals are talking to their team as early on as well, so we can get those identified and then make a decision. If it's not right for them and they're adamant, let's try and find either a position for them where they're not involved in so much in the conversations, or do we need to make a harder decision at the end of the day? But that's the type of thing we'll be talking about. Step 4 is patient communication. Now, we tend to go back and do quite a lot on this one. We've got lots of template letters that we know work because we've done so many of these. So we provide you with a template. We advise the dentists to make small changes, make it sound a bit more personal, as if it's come from them in their style, but the bulk of the letter sort of remains the same. We write out to the patients. You've got to give them 12 weeks notice along with the LAT, and we write out to the patients essentially saying, so if we were writing out at the end of the 31st of March, they would be going private from the 1st of July, and these are the decisions they've got to make and by when. And we've got these great plans. You're covered on the global dental scheme. This is what it covers you for. And it's only £15-20 a month, whatever it is we price it at. The letters include a QR code as well, so patients can sign up online from the letter, just to try and reduce the number of the amount of paperwork or calls into the practice. And then step 5 on the back of that patient communication is we come in for a couple of days when the letters have first landed. So we try and get the letters to land on a Saturday morning, and then we'll turn up in the practice on the Monday and Tuesday and just support the front house team, especially with any difficult conversations, loading patient mandates on the phone if we need to, and help out whatever it is that the team needs, really. And then ongoing support, we're reviewing numbers with you on a weekly basis, on a monthly basis, come up with a strategy. Are the numbers not quite where we need them to be? Can we do another communication of some description? What does that look like? Is it a mobile text number with a link? Is it another letter to the ones who haven't signed up? That sort of thing. So it's ongoing, really. And the idea is you get as many patients signed up on plan as early as possible. So by the time your contract's ended, you've already had a couple of months of extra plan income. Just to try and soften the blow.
Okay, I imagine each practice is different and it's case by case, but roughly, how long do you reckon the whole process will take? Roughly, ballpark.
Well, it does change from practice to practice.
I imagine it would, yeah.
Yeah, it's one of those where sometimes you can have a conversation with a principal and they've made their mind up already, and it's just, I want to get out as fast as possible. I'm completely stressed, and we can turn usually turn these 5 steps around in about 4 weeks, but everyone's got to be sort of switched on and ready for it. Because you usually find in that situation, the principal's already started engaging the team. And if they're coming to us and saying, right, I want to go, help me out. But, you know, it could be, I could be having conversations for 3, 4, 5, 6 months with principals. Just because they're so unsure.
Of course.
Yeah. So, but I would say probably 2 to 3 months on average from the initial conversation and then sending out the communication and the LAT, because usually people are pretty much decided when they when they have a conversation with us.
Yeah, no, that makes sense. To be honest, I thought the average would be a bit longer, so that's not bad at all. Okay, so how can people find out more?
Find out more? Well, just get in contact with us. I mean, my details are up on the slide now. So please feel free to drop me an email, give me a call on the mobile, or ring the office on that number there, 0344 848 6888. I'm the business development manager for the north of England, Scotland, and Northern Ireland. So if you fall within those areas, you'd speak to me. But I've got colleagues in the south and the Midlands and in Wales. So if you're within those areas, you'd be more than welcome to speak to my colleagues. But if you just want an initial conversation, just give me a call and we can chat everything through.
Brilliant. Well, I'll be sending these slides out with the recording after we finish here. So everyone will get your details. If anyone wants to find out more, you can go through to Patient Plan Direct. You can email me. You can contact Aaron. Anyone at Samara will make sure that you get in contact with the right person. Right, Dan, I can't think of any other questions. So unless you had any other last points to make, I think it's time to say thank you.
Okay, brilliant. Well, thanks for your time, everybody, and thanks for having me on, Chris.
No problem.
Really appreciate the opportunity to come on and speak to you about such an important issue. I would just say, look, everyone's stressed, and it's no obligation. If you just want to have a conversation, just reach out, because you never know, it might be the best thing you ever did.
Brilliant. Right. Well, thank you very much, Dan. Hopefully we'll get to speak to you again, or maybe someone else at Patient Plan Direct, because you guys have been brilliant so far.
Brilliant. Thank you.
Either way, we really look forward to it. So
cheers, thank you.
Thank you very much. And thank you for everyone for joining us. Goodbye.
Bye.